Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia, and after we've done it, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And this is no medical advice. We're just reading about it and talking about the blood system, internal anatomy, diseases, and this is part 3. And no medical advice, we're just reading about it. Iron deficiency anemia. And we want to prepare our presentation now about iron deficiency anemia. Okay, we want to say first, iron deficiency anemia is anemia caused through too little iron in the body. Iron is necessary to form the hemoglobin, to form or to produce the hemoglobin. By anemia, there are too little hemoglobin in the blood and they are carrying the oxygen. And the symptoms of anemia are when tiredness, shortness of breath, palpitation, indigestion, loss of appetite, chest pain in older patients, and swelling of the ankles in severe cases. Furthermore, headache and insomnia, pain of skin. Okay, if one or two we see. Okay, and then we're going to talk on and if it is the iron deficiency anemia, and if the anemia is caused through iron deficiency, then another symptoms is a sore tongue and inflammation at the sides of the mouth, on the side of the mouth, and also dry and brittle nail. Okay, when you're going on, what it gets worse. If you're going to start to review that, it gets worse through. It gets aggravated. Let's try to use the word aggravated. It gets aggravated. I actually don't really know what it means. Aggravated. I'm pretty sure it means it gets worse, or it means it gets stronger. But I don't really want to use the word if it is hard to understand. It gets aggravated. It gets stronger through pregnancy, heavy periods, or heavy blood loss overall. It can be also caused through an underlying condition like cancer, or what was it? Cancers, plies, and gastric ulcers and plies, whatever it is. Plies, cancer, gastric ulcers. Plies, cancer, gastric ulcers. And it can be also caused by or through rheumatoid arthritis and myxoedema, but also along with rheumatoid arthritis, but also along rheumatoid, I have no idea how to pronounce it, rheumatoid arthritis or myxoedema, or other diseases in which the hemoglobin is destroyed. And can happen the part of it causes. Let's stay away with chronic infections which interfere with blood formation. Why not? Imagine someone has a chronic infection which interferes with blood formation and they're just taking iron tablets. And also absorption problem of the bowel. Diet insufficiency. Okay, it gets worse through, let's take it, it gets worse through heavy periods, pregnancy, or heavy blood loss overall. It persists until it is. Then the causes of it are that there's too little iron in the blood, and that can be caused through not eating enough iron. It can be caused through bowel problems, if the bowel is not absorbing the iron. It can be caused through chronic infections, which are interfering with the blood formation, chronic infections which are interfering with blood formation, or let's try to name the tooth extraction also. So pregnancy, tooth extraction, heavy periods, or heavy blood loss overall. And it can be also alongside of, it can be also caused through rheumatoid arthritis or myxoedema, and it can be also a part of an underlying disease like cancer, gastric ulcer, or plies, or other diseases in which the red blood cells are destroyed. Okay, we have that part, and when it persists until it is If it is, in a sense, yes. But if it's just caused because someone eats wrong, then it would go away as soon as the person eats right. Away only until it's treated. Let's stay still away from that. It makes sense that this, by what I describe it, that it's persists until it is treated, but we have here so many other causes which can aggravate it, that is not the iron deficiency the problem or the other cause. We have here almost 10 causes named which have nothing to do with iron deficiency, or basically which cause iron deficiency, but the iron deficiency has not to be treated but the underlying cause. So to say that the condition persists until it is treated is, I don't know the word for it, is not leading in the right direction, because it seems to be very often that it is an underlying cause which has to be treated and not the iron deficiency itself. Complications none, treatment in the home none. So what are we going to say? There are iron tablets. Repeatedly. If people had heavy blood loss, don't mention that. If people had heavy blood loss or have heavy periods or during pregnancy, they might should consult a doctor to think about taking iron tablets. There are iron. Okay, we could say we could shorten it down. There are iron tablets to take it to get the iron amount again up to produce hemoglobin again, or we could say the long part. If people have heavy blood loss, heavy periods, or are pregnant, they could consult a doctor to think about taking iron tablets. We could just start and look how far we come. And let's just try it. I'm going to set the camera. Iron deficiency anemia. Iron deficiency anemia is anemia. So what meaning? Iron deficiency anemia. Iron deficiency anemia is anemia caused through iron deficiency. It can be also caused through other things. By anemia, there are not enough hemoglobin, so there are not enough oxygen-carrying hemoglobin cells in the body. And by iron deficiency, there's not enough iron in the human body to produce the hemoglobin, which is transporting the oxygen through the body. And the symptoms of anemia are tiredness and shortness of breath and palpitation, and also insomnia and indigestion, and loss of appetite, disturbed vision, and also maybe chest pain, and in severe cases, ankle swelling. Now, by iron deficiency anemia, there is not enough iron to form hemoglobin. And that can be caused because the people don't eat enough iron, or because the bowel is not able to absorb the iron, or because the person has a lot of blood loss, which can be caused from an underlying disease like cancer, plies, gastric ulcers, or through heavy periods, pregnancy, tooth extractions, or other things. And the symptoms are, by iron deficiency anemia, also a sore tongue, inflammation at the sides of the mouth, and brittle and drying nails. And it can be treated through iron tablets, and it can be a part also of other diseases like rheumatoid arthritis or myxoedema. And if persons have heavy blood loss, heavy periods, or are pregnant, they could consult a doctor to think about taking these iron tablets. And that is according to Keith Hodgkin's Family Medical Advisor, page 72, but this is no medical advice. That's one thing I forgot quite a lot. But I said also quite a lot, so what did I forget? I didn't really want to do the whole thing here, no? I said most of the things, pain of the skin not, headache not, but I said for most things, 2-3 not, which I wanted to say. So I'm going to stop the camera. And that was the iron deficiency anemia part. Anemia. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the shoulder impingement training, please put it on risk. Have a good and stable standing stance, and we're doing shoulder circuits. Back, up, and front, and down. and in front, up, back, and down. And now, long arms, strong fists, and go as far back as you can with the shoulders. High up, front, and down, back and back, up, front, and down. Again, up, back, down, and front, up, back, down. Now, what are we doing now? Legs wide apart, go down into the knees, hinge forward with a straight back, let the arms hang, and pinch the scapula with it. Make fists, lift the arms up and still pinch the scapula together. The arms down, shoulders, and another round, pinch the scapula together. Make fists, lift the arms up and still pinch the scapula together. And lift the arms up, the shoulders. And now a sheet jump up into the knees, hinge forward with a round back, with the arms hang, make fists, bring the arms to the inside. Lift the arms up and bring them together. Straighten up, and shoulders down and together. Now lift the arms up. Bring them together, shoulders down and together. And release. And another round into the knees. Hinge forward with a round back. Lift the arms hang, make fists, turn the arms to the inside. Lift the arms high up, bring them together. Straighten up, bring the shoulders down and together. So the arms high up and together, the shoulders down and together. And release. And now the next exercise, let's just lift the arms up. If this or any other exercise causes pain, then don't do it. Now the arms to the side and in front. Just observe what the scapulars are doing. And the next exercise, a wide lift. Go to stable stance, a bit over and shoulder wide apart. Long arms, strong fist, shoulders down and together, and turn the arms to the inside. So shoulders down, together, arms to the inside. Arms to the outside, shoulders down and together. Arms to the inside, shoulders down and together. And to the outside, the last time, shoulders down and together. And release. The arms to the side again, a bit in front, turn the arms in front. Shoulders down and together. And push arms back, shoulders up, back and front. And arms in front, shoulders down and together. Arms back, shoulders up and front. And release. And now, a shrug. Lift the arms up. And shrug the shoulders up. And release all down. And now turn the arms up. Shoulders up. And all down. And now, the pretzel curl. Arms together, down and to the outside. And now with thunder again. You can use the soccer something, have it with a long arm to the outside, let it fall down, and try to catch it again. If you flex the wrist down, then it might be easier to keep it straight down. And on the other side. And now stretching the elephant trunk, arm in front, shoulders back and down. Pull the arm in, have flat fingers, try to relax your arm, go with back of the shoulder, and turn the palm of it up to the sky. Relax the arm, go with back of the shoulder, pull the arm. And the other arm in front. Shoulders back and down, pull the arm in, have flat fingers, try to relax the arm, go with back of the shoulder, turn the palm up to the sky. And release. And that was the shoulder tension training. I thank you very much and till next time.